Live Fit Podcast, episode 130, Ayurveda with Dr. Charles Elder.
So according to Ayurveda, health is a state of balance and disease a state of imbalance. When the three doshas are present in the right amounts and functioning harmoniously together, we're in good health. If, however, one or more doshas becomes imbalanced or overactive, that sets the system off kilter and symptoms of disease can start to set in. And then we will use these three doshas as a platform for body typing patients.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you for listening. Today's guest is Dr. Charles Elder. He is a primary care physician with Kaiser Permanente in Portland, Oregon, and the lead of the Complementary and Integrative Care Clinic. He uses Ayurvedic medicine to treat his patients for any number of maladies. What is Ayurveda, you might ask? Let's let Dr. Elder explain. I'm sitting here with Dr. Charles Elder, who is a Ayurvedic doctor. Am I correct? Is that your title?
That's correct. I'm a primary care internist and an Ayurvedic physician.
And his resume is longer than my entire body, so he has tons and tons and tons of education and experience and research and articles to back him up. He's been doing this for pretty much your entire adult life. And before we get into any of the nitty-gritty, can you give us a quick overview as to what exactly Ayurveda is?
Ayurveda is the traditional healthcare system of India, and it's felt by most scholars to be the oldest system of natural medicine in the world that's been in continuous practice. It's useful for me as a primary care internist and integrative medicine physician because it complements conventional medicine very well. That is to say, where conventional medicine is strong, Ayurveda might not always be so effective, but where conventional medicine is weak or has shortcomings, Ayurveda can often be very effective.
Now, a lot of people who, maybe don't have a full knowledge of Ayurveda and some of the other alternative and complementary medicines might believe there's some sort of witchcraft or religious connotations or need for belief, or maybe it's all mind over matter. What can you tell me about that?
Ayurveda is a healthcare system and is recognized as such by the World Health Organization, by the National Institutes of Health. So it's a healthcare system. It's a science of how to care for ourselves, maintain our health, promote longevity in a holistic way.
Now, for my conversations with you, you've told me a lot about ways to eat that help prevent illness and also help, basically smooth operation of the body. And just now you're talking about it being a healthcare system. So aside from eating in a certain way, and we'll get back to that in a minute, how can it help a person medicinally?
Fair question, but I'll go back and emphasize first that food can be medicine. In medical school and my medical training in the United States as an internist, I trained at the University of Michigan. I went to medical school at Boston University. We didn't learn anything about food and nutrition. Almost zero. Whereas, I mentioned that Ayurveda complements conventional medicine well. One of the reasons is that the dietary prescriptions are very sophisticated. So we use food as medicine. What you eat, how you spice it. This we use not only for prevention, but to manage illness. In addition, there are a number of other modalities in Ayurveda as well. Mind-body techniques, herbal supplements, exercise, yoga, purification therapies. So there are other modalities that we use within Ayurveda beyond diet, but let's emphasize again, food as medicine.
Yeah, wasn't it Galen who said that? Let food be thy medicine.
Maybe.
I think I could be wrong on the person, but I think that's where I'm leaning anyways. Can you give me an example of maybe a common illness that can be treated by Ayurveda, maybe in a short term rather than preventative? For example, is there a food somebody can eat if they have a headache that will relieve the headache?
There may be maybe, but headaches can be complicated. So it depends on the situation. And it might not be so straightforward as you have a headache, take ibuprofen, it goes away. And maybe that the food, there could be issues with when and how someone is eating. There could be issues with what someone is eating. But in the case of headaches, there are different types of headaches. Is it a headache due to vata imbalance? Is it a headache, which might typically be in Western medicine, tension headaches? Is it a headache due to pitta imbalance, migraine headaches? Is it a headache due to kapha imbalance, sinus headaches? And then once we've sorted out what type of headache it is, well, how is the diet? But what else is going on? How's the patient's routine? What are some of the other things that need to be adjusted in the patient's lifestyle, and what supplements might help as well? So a lot of times it isn't as simple as just changing a single food. Now, it is true that there are some conditions that are very common that can be changed simply with some diet with an adjustment in one's dietary habits. For example, a lot of common complaints that we see in primary care internal medicine, like chronic fatigue, depression, lack of energy, a lot of these things will be due in Ayurveda to what we call accumulation, which is an accumulation of digestive toxins related to weak or improper digestion. And a major under-recognized cause of a lot of these symptoms is simply eating too heavily at night. Patients have chronic pain and they're eating steak and potatoes at 9 p.m. Have your steak and potatoes in the middle of the day, go very light at night. Will it solve all your problems? No, but it may solve a lot of them.
It sounds to me like Ayurveda is not so much a medicine in the terms of Western medicine that people think, oh, this hurts, that hurts, I feel, this and that and the other, and then you do some procedure, take a pill, take a spice, take an herb, drink a tea, but it doesn't quite work that way, does it?
Well, sometimes it does and sometimes it doesn't. So for, somebody might be healthy and they might have a cold once or twice a winter, or once or twice every winter. And then, the patient comes in, otherwise they're doing pretty well. We will give the patient some herbs, some teas, some spices, a little dietary advice to prevent or to treat these respiratory infections. So sometimes it can be simple, but most of the patients who are referred to see me, they've been to their primary care doc, they've been to specialists, they have chronic conditions where they're not making progress. So in my practice, you're right, most of the cases I see are more of a chronic nature. But Ayurveda is a healthcare system and it has utility for the range of healthcare challenges.
Now, is this something that a person would have to see an expert such as yourself, or is it possible to read a book or read some articles online somewhere that can point them in the right direction to help treat themselves?
Well, a little bit of both. I think that by educating oneself about Ayurveda, people can learn a lot about how to eat, how to live in a healthier way. However, there are some health problems, it's best to consult a physician. And in particular, if one is interested in, if one has a health challenge or a health condition for which one's being treated by a conventional allopathic physician, and one wants to add a holistic component or replace conventional medicine with holistic treatment, you really need to consult with a healthcare professional, someone who has the experience and the expertise and the judgment to understand what's appropriate and what isn't. Because there's a time and a place for everything.
A friend of mine, Ryan Corey, recently passed away from colon cancer. He was 35 years old. It spread to his liver. And I'm wondering if he had come to see you at some point when he started feeling symptoms and had his diagnosis, what you might recommend. He was having a lot of trouble. Let me just fill in. He was having a lot of trouble with constipation, no surprise. Also eating and keeping food down, and he was going through chemo. What might you suggest? Is there anything that Ayurveda could do to perhaps could have helped him?
Sure. It's very common for patients who are receiving cancer treatment to come to see us so that we can prescribe modalities to help the patient manage the side effects of cancer chemotherapy and treatment, and to improve quality of life. So a lot of times when patients are going through those treatments, number one, we will advise them about their diets, how to eat what we call a light diet, a diet that's very easy to digest and yet is nutritious and sustaining at the same time. A second set of recommendations for this type of patient might surround mind-body techniques. There's evidence that mind-body programs, such as the transcendental meditation technique, for example, can improve quality of life for patients undergoing cancer chemotherapy.
Oh, that's very interesting. I've never heard that one before. I want to go back to something you mentioned previously, the different constitutions, the vata, pitta, and kapha. Can you explain what those are and what kind of meaning it would have for a person?
Right. So according to Ayurveda, health is a state of balance and disease a state of imbalance of three fundamental physiologic or psychometabolic principles that we call doshas. Those are vata, pitta, and kapha. Vata governs all movement, mind, body, and spirit. Movement of thoughts through the mind, movement of food through the intestinal tract. Vata is often likened to a snake. Pitta is intense. Pitta governs digestion, metabolism, and transformation. The whole process of eating something, transforming what we've eaten into nutrients. It's governed by Pitta dosha. Pitta is like the sun. When we think of Pitta dosha, we think of the blazing hot sun on a July afternoon. The third dosha, kapha. Kapha governs structure and lubrication, mind, body, and spirit. It's the heavy physical dosha. It's heavy, sweet, and steady. Kapha is like a swan. Okay, it's the physical structural dosha. So health is a state of balance, disease a state of imbalance of these three doshas. When the three doshas are present in the right amounts and functioning harmoniously together, we're in good health. If, however, one or more doshas becomes imbalanced or overactive, that sets the system off kilter and symptoms of disease can start to set in. And then we will use these three doshas as a platform for body typing patients. While all of us have all three doshas governing the physiology, most of us, by virtue of who we are and how we have developed, are naturally inclined to express the qualities of one or two doshas more than the other. Some of us are vata types, some pitta types, some kapha types, or various combinations. So we will categorize a patient into one of these body types or constitutional types, and knowing one's constitutional type helps us to figure out how to manage our health, because given a set of medical problems or concerns, what's right for one person might be wrong for the next, depending upon who the patient is and how he or she is built.
At first, when you were explaining the constitutions, it sounded like you were leading to an ideal of each person being equal amounts of the three doshas, let's say a third of each. And then you were talking about somebody might be higher in one than the other. Is there an ideal?
There isn't. I mean, there is a sense of ideal health, but it is not the case that we're all trying to have the same amount of each of the three doshas. So some people are naturally pitta types just by virtue of who they are and how they're built. Okay, so to give you an example, let's say the qualities of vata are typified by, we said, a snake or a hummingbird, right? Little bird buzzing around. Okay, you don't want an elephant acting like a hummingbird. And you don't want a hummingbird behaving like an elephant, because that's not who that person is.
How can knowing what a person's constitution is help them? For example, I'm primarily pitta, but still high vata, not very high kapha. What does that tell me about me?
Okay, so this understanding one's body type gives us a window into our strengths and vulnerabilities. It can tell you what sorts of foods to favor or avoid. It can tell you what sorts of climates to would be beneficial for you. It can tell you what sorts of exercise, what sorts of work would be ideally suited for you. And when health challenges come along, it can help you to frame them and to understand whether they may be more or less serious. So, for example, a pitta type is inclined. Pitta types are naturally inclined to inflammatory conditions, maybe at more risk for acid dyspepsia, skin conditions. So, a pitta type, seeing those concerns, well, we might be thinking, well, we need to be careful with this because this might be potentially a chronic situation. Pitta types are much less, generally speaking, inclined to problems with, say, constipation or with colds or respiratory infections. So a pitta type who comes in with a snotty nose, I'm less worried about this being something of a chronic nature.
Oh, that's interesting. I am from the Mojave Desert, and if you've, by the sound of it, you probably picture that it's hot and dry a lot of the time. Sandy, many shades of brown. And now I live in Portland, and I flipping love it up here. I feel like, a hog and slop or something for, it just really, really suits my body type very well. Would that be predictable if you had seen me many years ago and, we had this discussion? Would you told me to move?
Well, we might have told you to move or suggested it. So yeah, that is predictable. So our weather here in Portland is kapha aggravating weather. It's cool and it's wet. So pitta types will like this climate because it's cool and wet. It cools people off. So you move to Portland, and over a period of 10 or 20 years, we'll all have a lot more kapha in our constitution as time goes by. Move to Phoenix, Arizona, or to the Palm Desert, or to your hometown, and we're going to develop, with all that heat, over a period of time, pitta will become aggravated. So someone with a natural pitta constitution might not want to hang around those places.
The warm, dry places.
Or the warm places in any case.
Oh, so the humidity doesn't matter. It's the heat.
It's the heat.
Another thing that partly drove me up here and that I like it here is I like overcast skies. Bright sun bothers my eyes. The reflections off of car windshields, whatnot, really, really, really are difficult to deal with. I need these goggles at times. Is that pretty much predictable by my constitution?
Classic.
Okay. How else can I use this information? Will it help point me away from a certain disease that I might obtain otherwise, or an affliction or something like that? Not an accident or a communicable disease, obviously.
Okay, so pitta types are most, when balanced, are very dynamic people. They're energetic. They have keen intellects. They're efficient. They get things done. They're excellent leaders and public speakers. So that's all good. Well, what about health risks? Pitta, when out of balance, can give rise to heartburn, acid indigestion, temper flares, anger, skin conditions. Any inflammatory condition will generally be due to a pitta imbalance of one type or another. So what do we do about that? Let's say you're feeling great. No health problem. Well, what do you do for prevention? Well, we follow a pitta balancing diet. A pitta balancing diet is food that is a diet that avoids too much sour, hot, spicy, or salty food, while favoring sweet, bitter, and astringent foods that are cooling in terms of how they're spiced and moderately oily. So knowing which foods to avoid, too much salt, too much hot spice, can be really beneficial to the patient. Knowing which types of exercise. So for example, pitta types need to avoid intense competition. So you can exercise, that's good, but you might want to be aware that, say, competitive tennis might not be ideal because it tends to imbalance patients of that constitution.
I find many of those things that you said very interesting because I am a very competitive person, even and maybe even especially with myself. However, the types of competitions I prefer are more solo or time-based, so a time trial of any sort. I don't like the shoulder-to-shoulder, elbow-to-elbow competition with somebody right there with me bumping and jostling, and some people thrive on that and love that. Is that typical of pitta?
Well, it certainly is typical that you love competition and that you like to challenge yourself. And some people, everyone's different. Some people might thrive on the team-based competition, the elbow-to-elbow, I'm trying to beat the guy next to me sort of thing as well. The point is it's something to be aware of, that exercise should remove stress from, not create stress for the physiology. So you want to be doing exercise that's good for you. And if you're a pitta type and every time you go out to your tennis league, you come home 3 times as pissed off as you were before you went, it's probably not the right type of exercise.
That's funny. That's funny. Another thing you said that I wanted to hit on, and I'm embarrassed to admit, but I do have temper flares, short fuse. I don't have that acid indigestion, heartburn. I don't think I ever have. So let's say I want to prevent temper flares. How would I stay in balance?
Okay, so again, this the whole suite, if you will, of pitta balancing approaches. Be on a good daily routine, proper diet, the pitta balancing diet. I laid out some of the parameters. Pitta balancing exercise. Make sure you're getting enough rest. Make sure you're controlling stress. You can use, there are certain herbs and spices that you can use in your food specifically to keep pitta dosha balance. And when you start noticing some of these symptoms, temper flares, heartburn, whatever it is, take a step back. What am I doing? Don't push yourself too hard. Pitta types will tend to push themselves too hard. We want to conquer the world tomorrow. Take it easy a little bit. Take some time to smell the roses.
One correlation I have found, well, two. Okay, one is stress. So if I'm in a stressful situation, I tend to be pretty short-tempered or less patient. Another is, and I haven't noticed this every single time. Well, this hasn't happened every time, but often it happens right after eating a big load of sugar. So if I were to have a piece of cake or a ice cream cone or something like that, not every time, but occasionally I've correlated that with a short temper.
Well, that's an interesting one. So I would say that as a general principle, sweet foods, if they're sweet foods as a taste, is balancing for pitta dosha as well as for vata. Now, anything in excess can tip the system out of balance. So if you're having 3 scoops of ice cream with a bunch of those little chocolate sweet things on top and you really overdo it, well, that can too much of anything can put us at risk.
So one more question I had based on what you were saying a bit ago is you said that hot and spicy flavors foods are not balancing for pitta, yet I like those types of foods.
Okay, so there could be one of several things going on. Number one is, so when we crave things, we generally crave things that are good for us. So, for example, for pitta dosha, sweet, bitter, and astringent foods balance pitta, while sour, salty, and hot, spicy, that is to say pungent foods, imbalance pitta. So normally, quote unquote, a pitta person would be repulsed by hot, spicy, sour, salty foods, or not, just want to avoid them. However, so that would be the normal instinct. However, we can become addicted to the wrong thing. So in the same sense that, well, for a smoker, the worst thing for them is a cigarette, that the patient is addicted to the nicotine, and so they have a craving for it. That's an addiction.
Well, that's fascinating. So even though I don't use spices on my foods every day, I don't eat hot, spicy Mexican food. I mean, coming from Southern California, I got to really love Mexican food and hot sauce and salsas and things like that. So are you saying I sort of acquired a taste to it, and maybe there's some component of addiction involved?
Well, a couple of things. Spicy, spicy, when we say it, incorrectly connotes hot spicy, because it's important to use spices in our food. Well, which spices? There are many spices that are cooling by nature, not heating, and thus are balancing to pitta dosha, fennel, saffron as examples. So we want to include the correct spices in our diet. Now, I am saying that it is possible for us to become addicted to the wrong thing for whatever reason, environment, culture, habit. We can become addicted to hot, spicy foods, even if it's aggravating to our health. People will become addicted to tobacco, to wine, to sweet foods, salty foods, when it's the wrong thing for them, and they'll crave it because they're addicted, because it gives them a kick.
I've been the type of person who's been pretty in touch with my body. I listen to my body and don't always interpret it correctly, yet that has been my guiding light, mostly speaking, for nutrition. And I find it interesting that I'm not adverse to hot sauce. Now, and when I said spicy, I did mean hot spicy, when you feel that burn in your mouth. Now, since speaking with you however many months ago, I have been changing the way I eat, and I've used almost zero hot sauce since, maybe just a dash here and there, just because I really wanted some. Do you think if I go without for a while, then I will have an aversion? Will that break that quote-unquote addiction?
It may. Now, you might notice that you lose a craving, because it is natural to crave what's good for you. And if you've had a craving for the hot, spicy salsa, you may lose that craving as you stay away from it, especially in hot, sunny, like in the summertime.
Right, which always cracked me up that Mexican food is classically hot, spicy hot, and northern food is more bland by nature. Okay,
well, there is an explanation for that in Ayurveda, that in the hot climates, in Ayurveda we call digestion Agni, which means fire. Okay? So the Sanskrit word for digestion, Agni, is the root of the English word ignite. So when we think of our digestion, we think of a gas stovetop or a campfire. So it's really, really hot out, then there's so much heat, then Agni is lowered naturally. So we need these spices to heat up Agni.
That's counterintuitive. In a hot climate, our digestion is decreased, repressed?
May tune down a little to compensate for all the heat.
Wow, that's fascinating. That's definitely
an interesting explanation.
Counterintuitive. I never have heard that or thought of it. A silly question, but I've had a couple people who love to drink coffee will drink hot coffee in hot weather, and they insist it cools them down. I absolutely positively do not agree with that. I think they're trying to justify their desire for drinking coffee, not like you really need to justify it with me. But is there anything to that?
No, I'm with you.
Okay.
No, so caffeine is imbalancing to both pitta and vata. And if it's hot coffee in hot weather, it's really going to throw pitta off. In this climate here in Portland, where it's always cool and wet, a single cup in the morning, we don't mind. We pick our battles. But less is more as far as... Now, if someone is really a roly-poly, Winnie-the-Pooh kapha type, a few cups of coffee during the day is fine. For most of us, less is more.
Gotcha. I like that less is more thing. Now, we spoke, and you gave me instructions on how I should eat, which is eat breakfast if I want it. The middle of the day should be my largest meal. Pyramid type eating, little in the beginning and very little in the end. Keep the spices down. Cook all of my food except for honey, and get to bed and asleep by 10 p.m. Is that strictly for my type, or how would that translate with others across the spectrum of the different compositions?
Okay, so what you just mentioned, there are guidelines of proper digestion, and there's a daily routine that applies to just about everyone. You may be a little more liberal or more strict with certain people on specific points, depending on the body type. But as a general principle, early to bed, early to rise, exercise in the morning, have your main meal at lunch. That's the foundation of the Ayurvedic daily routine. And in terms of when do we eat, main meal at lunch, don't overeat at night, that's foundational for the Ayurvedic diet. That applies to everyone.
Gotcha. Sounds like words of wisdom. I think Ben Franklin said something very similar to this Ayurveda. Maybe he knew about it? When did Ayurveda hit the United States?
Well, it's in the past few decades that it's become popular, but likely it wasn't alien. It's been around a long time.
And it does have a certain common sense about it, too. Why eat a big dinner, and even though that's pretty darn typical in the U.S., but you're just going to go to bed pretty soon, or at least be fairly sedentary unless you go out dancing.
Exactly right. Now, the rationale in Ayurveda is that your digestion is naturally strongest when the sun is highest in the sky. So I'll tell patients to think of your digestion as a gas stovetop that you've got on high at noon, lower, 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 lower. At midnight, it's almost off. Higher, higher, higher. At noon, it's back on high again. So you want to eat when the fire is strongest.
And you said it's best to go to bed to sleep before 10 p.m. What happens if you can't, and your typical bedtime is 11 or 12 or later?
Okay, so the ideal bedtime is 10 p.m. The ideal time to wake up in the morning is 6 a.m. So, and we're not freaks about this. So, okay, 10:15, 10:30 at night, we're not going to have a wrestling match over that. But generally speaking, there are certain physiologic activities that are designated for specific times of day. So the best time to go to bed is in the kapha period of the evening, the period of the evening when kapha forces predominate, which is between 6 and 10 p.m. You fall asleep then, and like kapha dosha, which is heavy, your sleep will be heavy. If you make the mistake of staying up too late, 10 to 2 is a time of night where pitta forces predominate. Pitta governs digestion and metabolism. This is when the body metabolizes and processes the day's wastes. This is when the cleanup crew comes in. So it's important that we're resting so the body can properly cleanse itself. If we're habitually awake between 10 p.m. and 2 a.m., then the natural cleansing processes are inhibited. Ama, those are digestive toxins, start to accumulate. There's the ground floor where disease gets in. So that's why it's so important to your long-term health to get to bed by 10 on a habitual basis.
Is there an impact on the immune system?
There can be an impact on the immune system and on the entire functioning of the physiology.
Now, I have a couple of friends that have erratic schedules, meaning their work schedules keep them up either late or all night. Any advice for somebody that has to work nights, or at least late at night and can't get to bed until 2 or 3 or 4 in the morning?
Yeah, I have a lot of advice about that, and a lot of sympathy. Being an internal medicine physician, I've spent too many nights up all night in the hospital, and those of us who have done it a lot all know that it's bad for your health. And this is borne out in Ayurvedic theory. This is borne out in Western science. We know that people who work the night shift live shorter lives. This has been shown. So someone's on the best shift is a day shift. If you're on a swing shift, we can deal with it. let's try to avoid the night shift as much as possible. Someone who's 22 years old gets away with it for a year or two, but for most of us, this will wear on the health.
Even if they're consistent with their sleep and wake times, if they, let's say, reverse their schedule 12 hours and they woke up at 6 p.m. instead of 6 a.m., over time that would not, you wouldn't be able to balance your doshas?
No, it doesn't work that way. Bats work at night and sleep during the day. People work in the day and sleep at night.
I guess that's all there is to be said about that. Dr. Elder, how long have you been practicing Ayurveda?
I've been a primary care physician for almost 30 years, and I've been incorporating Ayurveda into my practice for most of that time. And then for the past 18 years, I've had a referral-based integrative Ayurveda clinic at Kaiser Permanente Northwest.
Nice. Long time. How did you get into it?
Well, what I found was that I was learning conventional medicine, internal medicine, and I found that a lot of the problems that my patients came in with, I wasn't able to fix. I wasn't able to help them just using conventional medicine. I went to a meditation course once when I was in residency, and the speaker talked about Ayurveda. That's the first time I heard of it.
I heard about it when I was in a yoga class once. A visitor came in and talked to us the last 10 minutes or so about it, and then offered a free evaluation, which I went to, and I thought it was pretty interesting, and I've been interested in it ever since. Obviously not to the point that you have, but it's been something that has kind of fascinated me, and anything that's been around that long must have something behind it.
For sure.
Now, you have a book coming out, correct?
Right. I was on sabbatical last year, and I wrote a book with my wife. The book is called Picture of Health. It's a self-care manual for patients that helps us to better understand how to care for ourselves using the Ayurvedic approach. It's the release date hasn't been announced. It should be toward the end of this year, coming from the Permanente Press.
I can't wait to read it. I will have information on your book in my show notes page at livefitpodcast.com, and I thank you very much for your time. It's been fascinating.
Thank you.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com. Once again, thanks for listening, and always remember to live fit.